Hey y'all, hey, it's your girl, B Tina B. Hey, and how you doing today? Oh, welcome to the B Tina B show. Faith Talks. This new hair, I don't care. Okay, y'all know how I do it. I like to keep you guys on your toes. It is so good to see you and to have you in here tonight. So come on in, come on in, come on in. It's a thankful Thursday, all right? I am so excited. I ain't played my music in a while. You know that? I just thought about that. I bet y'all missing a little bit of that. I'm missing it. Well, as you know, we're here every Thursday night, 7 p.m. Well, we try to be here every Thursday night. Sometimes things happen and we have to do rebroadcasts. But hey, tonight we are here for you, and we have some hot topic tonight as we're talking mental illness. Thanks so much for watching. Come on in, come on in, come on in. I have a very dear friend of mine who will be here with me on tonight, and we will be discussing mental health and during this pandemic because everybody a little bit of cuckoo for cocoa puffs. If truth be told. So I would like to present to some and introduce to others none other than Miss Shawana Torrence. Come on, put your hands together.
Hi, hello, hello.
Hey, how you doing?
Doing well, doing well. Hope you are. Hope everyone out there is doing well tonight. Thank you for having me.
I'm so look, couldn't miss it. We had I want to put out the disclaimer that Janet Raleigh Wright was supposed to be with us on this evening, and due to some extenuating circumstances, she was not able to come. She's going to try to chime in tonight. Um, hey, Javetta, what's going on, sis? What's going on, Javetta? So great to see you, babe. Thanks for chiming in. But as I was stating, our special guest tonight, Janet Riley Wright, was not able to come due to some serious unforeseen circumstances. So I want to make sure we just, send her out some prayers and love and hugs, you know, keeping her strong because she is a huge advocate and the reason for this conversation that we're having on tonight. She is so passionate about it. And I can't wait till she comes back, and she will be coming back on after she goes through her situation right now that she's dealing with. But I have someone that's equally as passionate. Hey, Patricia, how you doing? Come on in, come on in. So good to see you. Thanks for coming in. Come on in, come on in. So, girl, how was your day today?
Excellent, excellent. Today was a busy day, but all is well. I'm grateful to God for the strength He allowed us to make it through and still pressing our way right now.
Absolutely.
So yeah.
Absolutely. And you're always on the go. You are a woman on the move. Master's degree. What are your degrees in again? I want to just brag on the people a little bit. Because I got friends in high places, and I like to make sure I like to shout them out as well. Okay. Miss
Oh, bless
Shawana
your heart.
Walker Torrance. Come on, give it
Bless
up.
your
Let's
bless
talk
your
about
heart. All right. Well, great. I'm grateful for having the opportunity to have, you know, uh, taken part in higher education. And so I do have my master's degree in adult education and my bachelor's degree from High Point University. And I'm very, very much excited, about the opportunity to be able to share with everyone tonight relative to your topic. And I did earn my master's at the illustrious North Carolina A&T State University.
it. Aggie
Cannot
Pie.
go without Aggie Pie. Exactly. So, and I did that, of course, as a non-traditional student. So I'm very, very proud of that because I'm always encouraging everyone to let them know they too can realize those dreams if they would like as well. So anyway, very, very excited to be here. Very glad, very honored to have attended both those fine universities.
Absolutely. And they were blessed to have you as a student and to be able to come back and enlighten the world with your gifts and the knowledge that you have acquired from those universities. So I'm shouting out High Point because that's my city. Whoop whoop. HBU, North Carolina A&T, Aggie Pride. I've taken classes there. My son was there. We did a whole lot. And it's about to be homecoming, y'all.
About to be homecoming.
The
Yeah.
greatest homecoming on earth. I mean, come on here.
Absolutely.
I mean, all right. We got to, let's tell it like
Be
it
great.
is.
Be
Okay.
great. Right,
Yes.
right.
Yes. Thanks so much, Javetta, with your beautiful self. Thanks so much for chiming in on tonight. Listen, guys, this is a subject that, especially in Black and Brown communities, it's very challenging sometimes to talk about. But because we're in this pandemic and lives have changed so much, and I have said on occasion that this is the closest that we may have ever had to experience what someone that has a mental illness has gone through or may have to go through on a day-to-day basis in this season, this colorful season that we're living in, because we're living in a season and we're using colors in our on our palette that we've never maybe even seen before, and we have to adjust. And I've noticed that in the season that sometimes there's some unnecessary roughness that people or even companies or friends and families may be using. And one of the things that I wanted to do is present to you Miss Shawana Walker Torrence, because she is a former CEO of, let me make sure I get it right, Serenity Rehabilitation Services and Integrated Healthcare Organization. She is also an independent consultant to healthcare organizations. And so she has a upfront knowledge about what it takes dealing with patients, dealing with their families, and knowing what it is behind the scenes of working with people that are going through mental illnesses. Am I correct?
That is correct. Yes, ma'am. Absolutely.
Tell us how you end up getting into mental illness or mental awareness. Let me say that, mental illness awareness, because I don't want this to be something that will scare the people, but that will enlighten them and maybe encourage them to have a inward look at themselves and
Mhm.
their family members, and maybe give a little more grace to those that may be going through.
Oh, sure. My experience, my for one of my first encounters with mental illness, of course, it started with a family member, and with the family member, sometimes, especially in the African American communities, not oftentimes are we seeking medical attention for behaviorally driven situations. And so my experience came from a family member and me recognizing that something was wrong. And so working with the medical community was able to identify what the mental illness was and begin to learn some of the things that we could do as family members to help make the days easier, not just for the family member, but also for the family. And so my introduction to that was very early on. And of course, as I furthered my studies, my education, I began to kind of center my my work in the university. When I was working on my bachelor's, I kind of centered my senior project around mental illness and the effect that it had on families, because I was directly involved with with a family member that was suffering from mental illness. And so from there, I realized that my passion always was to help others, but I never knew in what capacity that would be. And so from there, I basically just furthered my education. I furthered my networking. I had a a really nice, strong mentor in my undergraduate program that actually pushed me a little further into exploring and seeing what the opportunities were, especially in the workforce once I finished my bachelor's degree. And so from there, I literally walked away from what I call corporate America and basically kind of just dove right into the field of human services. And I'm very, very glad that I did. And that's pretty much how I've ended up there. I've kind of you know, brought human services and corporate America together, you know, in order to provide an organization where where practitioners could have a viable place to practice, and of course, patients could have a very comfortable place for treatment and healing. And so that's where I basically just, you know, brought systems together to make them work, to have them working in a way that was beneficial for patients and both the you know, the community that we were in. And it worked very well. We worked with a lot of people. I've had the opportunity to meet a lot of people that have various disciplines, whether they were medical, clinical, you know, administrative. And so it takes all of those components to
Absolutely.
really help someone individually and to help them and their family. So that's kind of where how everything kind of came together. People ask me all the time, did you go to school to do this? And at first I used to say, no, I don't have a degree in a behavioral health clinic. I don't, you know, but I do realize that all the skill sets and all the things that I've learned, all the skill sets I've acquired, all of that contributed to being able to provide a wonderful integrated care clinic where patients could come and get quality treatment. And of course, practitioners had a very viable place to practice.
So, formal and informal education and training works hand in hand, because
Mhm.
there are things that I picked up that you said that there was a family member. What was it about that family member that you began to notice that said that something's just not quite right? Because you know how we'll say, oh, they're just crazy, they're just cutting up or whatever.
Mhm.
At what point did it come to you that there's something more than just they just being silly?
Yeah, absolutely. So being able to recognize some of the triggers for behavioral health, and let me talk about the term behavioral health. You don't often hear behavioral health, but behavioral health is the overarching term that basically covers mental illness and substance abuse. Okay, and so those are two different sectors, but they're both behavioral health. They're both behavioral driven. And so with behavioral health, you can experience, or you may know someone that suffers with mental illness, or they suffer with substance abuse, and sometimes it's both, you know. And so, with a particular family member, you know, I noticed that the behaviors were not what I would deem to be, you know, within normal limits. And
Mm-hmm.
so when I talk about within normal limits, whenever those behaviors have an impact, a direct impact on the life and the being of a person and those that are around them, then there is possibly a problem. However, someone does have to go through proper assessment, you know, to kind of get further into what the challenges may be. So for me personally, with the family member, you know, we experienced, you know, several triggers that let us know that things was wrong. There was, you know, constant incarceration. There was constant fights. You know, there were episodes of, you know, not realizing the dynamics of the family, like the parents, the siblings, you know, things like that. And when I
Let
say not
me, let me
realizing,
let me interject right here. I want you to I want this to be heard
okay,
very loud and clear, especially in our Black and Brown community. The first thing that you said was constant fighting, didn't you?
constant, that was one of them, yes.
Fighting, and the other one was
Fighting, incarcerations,
those two words. There were
legal
things that were
issues.
happening to him that was, and so that caused him to act out in the way that was not normal. Okay.
So, so yeah, there were things that at the time we didn't realize, but you know, when we talk about mental illness, you have to look at the clinical component and the medical component of what's happening with between the brain, the central nervous system. All of that medically ties together. That's why it's very, very important to try to recognize the triggers and also to have somewhat of a history of the person's medical history, because mental illness it does fall up under the medical spectrum. When those breakdowns happen, there are things that's happening with the person medically, in the brain, in the nervous system, the
Mhm.
components that helps our body to function within normal limits. And so
Mhm.
when those breakdowns happen, typically there's something going on medically as well. So you being able to recognize one or the other, and of course advancing help towards a person can help them a lot earlier. But yeah, those triggers, legal issues, communication breakdown leads to constant arguments leads to fights. You have a person that they may not be physically harming themselves or others, but they may have the thought, that they want to do that, something
Mhm.
to that effect. So, being able to listen and somewhat understand. Now, I'm not saying that everyone that, have a thought to,
Right.
harm someone, but at the same time, when you observe, being a very observant person, you may want to consider that that is a breakdown for the person. So being able to recognize triggers, and there's much material out here that will help someone to be able to recognize, triggers. If there's a suspicion that there is some breakdowns that are going on, chemical breakdowns in the brain, that leads to the central nervous system that affects our thoughts, affects our ability to function. As well, there are some other triggers that should be notable as well, because not everyone goes through those type of triggers, but you have triggers where people withdraw from others, where
Right.
they don't want to get out of bed, where they don't want
Keyword
to,
behavior. Mhm.
and so these are all behaviors that are not typical and what someone would say as normal for that particular person, okay? Because we do have to recognize that some things that are normal to others may not be normal to us, but that doesn't make them abnormal.
I like that because I don't want people to get stereotyped
Mhm.
because okay, well, something must be wrong. But the behaviors, when we're recognizing behaviors that aren't consistent with who that person may be, especially if it comes sporadically, or
Mhm.
if it comes just out of the blue one day and they just it may not, we have to look a little bit deeper because sometimes we're just touching the surface and we'll either shrug it off. And especially in the black and brown community, I want to talk specifically about the black and brown community because that's the community that I'm more familiar with. We'll get some other people that aren't black and brown to talk about what's more native to, that's more aligned with their actual ethnicities. But anyway, I think it's very powerful that you said that they're not abnormal. Just because you hurt yourself, or this is the way Janet and I were talking, and I miss her tonight because I would love to have the three of y'all on this conversation because, and we may have to. There she is. There's my friend. She's watching. Thanks, Janet. Yes.
Hey, Janet.
And I know she desires. I mean, I know she wants to be on here, but as I said before, she has some extenuating circumstances. And if you ever want to chime in, let me know, because the conversation between the three of us on here would be so dynamic. So that may be another look a little bit later on when she's able to get back with us.
Mhm.
Um, she said, "Hi, ladies."
Hello, hello.
So let's talk about, so now that we know that there are behavioral situations, because I think that that was very important to address, that a lot of
Mhm.
it's the behavioral situations that may call mental situations and breakdowns. Am I correct?
Correct. There
Okay.
are, as a result of the breakdown, the behaviors kind of show up.
Okay. So one of the things that you wanted to make sure that we discussed, and I think it's very important as well, is self-care.
Absolutely. Self-care is extremely important. You mentioned at the beginning of the show, that the fact that we're still in a pandemic, and we know that since the pandemic has, became prevalent for us, we know that our lives have changed significantly. And when that happens, sometimes we're not necessarily paying attention to everything that's around us, and definitely we're not necessarily paying attention to ourselves. And unfortunately, sometimes those things don't come to play for us until there's something very significant that happens to us. It can be, something traumatic. It could be something that just, a significant life changing, life altering situation. So, in order to think about that and think about it in a way that we can somewhat take care of ourselves, because if you know, you have to be able to take care of yourself before you can really take care of others. And I make that comparison to if you're flying. If you notice when you're flying, whoever is going to be the assistant who's sitting on the wing and going to help in case of an emergency, they have you to take care of yourself first in terms of oxygen and air and all that before you start taking care of others. Because if you don't, you're not going to be in a position to help yourself or someone else, and so that's not helpful for either one of you. So self-care is a huge important piece of being able to manage and maintain, particularly in the pandemic that we're in. Although sometimes we feel like we have a handle on everything, I'm able to work, I'm able to eat, I'm able to, do the things I've normally been doing. I've been able to
Robot.
avoid being sick. But sometimes just the routine of that can be, weight bearing on us mentally and physically. And so we have to start looking at what we call preventative care. And just like we take preventative care for our physical health, we have to do that for our mental health as well. And so preventative care can mean something as simple as carving out 1 hour in the week where you're just focused on yourself, whether it's meditating, whether it's doing, your favorite thing, or doing a small, nothing that's overexertive, for you, but it's just, time just for you. And so there are several ways that you can, look at carving out time for yourself. There's lots of things that you can determine that is good for you. And it may be something as simple as sleep.
That.
Oftentimes, preventative care requires that we get the proper amount of sleep. It's amazing how some people don't associate the proper amount of sleep with the health systems of our bodies, both physically and mentally. If that a proper amount of sleep is not obtained, eventually there could be a breakdown somewhere. And so, looking at preventative care, it talks about being able to recognize, what your body needs. And then of course there's those other things, those other factors, what we put into our bodies,
Let's
what
go
we
back to
eat.
the sleep. That let's go back to the
Right.
rest. So because we're in a pandemic, okay? And so
Mhm.
everybody, some people are still working from home, and you got children crying, and you got a husband that's tapping you on your shoulder. You got your mama that wants you to come by because she needs you to run to the grocery store for, or she needs to get her medications, and we need to, we still got to do our work. Oh, and then we got to clean up the house, and then we still got, activities that need to be done. How you gonna get enough sleep? How do we give us a measure of being able to say, how do I woosah? How do I wind that thing down so that I can shut down after my children have been calling on me, or my husband has been tapping me on the shoulder, or either after my mom's been calling me and my sister's telling me about what's going on with her day, because and then you got to talk to your girlfriends because all of that, and because we need that interaction. How do we get enough sleep?
Right. Well, you would imagine, recognizing your sleep pattern and understanding your sleep pattern and what works well for you is important. I will say this, not everyone requires the same amount of sleep as, the other person equally. So recognizing what works for you and what causes you to be able to function well. And when you do that, you are able to somewhat carve out a schedule for yourself. Not everyone operates on a schedule per se, but with what you just described, you know that some of these things are going to happen routinely throughout a 24-hour period. And so being able to slide in and say, you know what? I need to block off some time. We take time to go to the restroom. We take time to physically pick our hand up and put food to our mouth. That's just as important as
Girl,
taking
you know
time.
we be eating on the run. Girl, nobody, who
Even if
we on the
even if
go.
we're eating on the run, we're still making that physical act because our mind is thinking about we need to do that. Our body is telling us we're hungry. Our body is telling us we're tired. And one thing that I'm certain of is that if you don't pay attention to what your body is telling you, if you don't take advanced care of what's required for you, your body will tell you something different by way of it'll say, I can show you better than I can tell you. And you will find yourself in a state of not being able to do the things that you got going on for the 24 hours. So you want to kind of get in front of that because recovering from that is a lot harder than it is to take out 30 minutes, an hour, whatever that time frame that you need for yourself. So there are several ways that it can be done, and realize everybody can do things differently, but as long as you get to the same goal of preventative care, self-care, then
And
that's okay.
advanced care. I heard
And
that advanced care. That
advanced care,
advanced
in
care. So
advance.
you're
Yeah.
actually planning for what it is that you know that you need: the
Mm-hmm.
sleep, to eat, and to, I'm gonna say, pray, because we talking faith talks.
You
Hey.
can. Right. Right, exactly. Pray, meditate, quiet, a quiet space, whatever that identifier is for you. When you realize what that is, you make it happen. When we go in for our checkups, to our medical doctors, they're checking our systems, taking our blood, checking and listening and all that. And then they listen to you as well, and they ask you questions. And these questions include, are you taking care of yourself? Are you getting the proper rest? And if you're not true to yourself about these things, you're doing a
You're
disservice to everyone.
absolutely. And
And
so
and it's
these
okay.
are conscious, and these are conscious decisions and choices that we have to really make now, because before, where we had outlets, because sometimes, being in the house, it might not be that you need to sleep, but you might just need to get away from noise and, settle down. But we have to consciously choose to do these things to create the atmosphere that we need for our mental and so that our behaviors are not something different from what our norm is.
Absolutely. All of that helps your behaviors to stay within the limits that you would want them to be, that you would like them to be, that others recognize of you as being you. When those when you come outside of those, someone may notice something different, but of course they may be reluctant to say something or to, ask you a question. And that's okay because, not everybody pounces on everyone when they notice something different. However, when the major domains of your life are being affected, then there should be, questions to be expected to be asked. If you notice that you're losing weight, really fast and quickly, you notice that your hair loss, your body will give you a lot of different triggers, that lets you know that something is wrong. And so you yourself might notice this, which would be a great thing, because then you can go ahead and kind of get in front of it and have that advanced care. But at the same time, if you're not able to notice it, and sometimes behavioral challenges does not allow for the individual to realize what's happening with them. And it takes others to be able to kind of, paint the picture, especially when they're seeking help. But that's one of the things that, I'm going to kind of move into that segue of knowing when to get help, where to get help,
That's
how
what
do
we
we get
wanted. That's what I was you're right where I wanted to go. And that's where I said the behavioral challenges. So we're right
help.
on task.
Mhm.
Um, Go ahead.
So, realizing that if there is a challenge and we need to get help, one of the things I always recommend to individuals is to, start with their primary care, and then realizing sometimes individuals, they don't have a primary care.
And let's talk about how important that primary care doctor is, because they know there's a history there.
Right.
That's why we call it the primary care doctor. It's not just about going to urgent care. It's not just about going to the emergency room and piling up those bills. It's usually a lot less expensive when you go to your primary care doctor, or to you have if you have a specific doctor that you can go to, so they can say, okay, okay, I can see. Let me see. You gained a few pounds. Oh, you still at this weight. Oh, well, what was going on here? Your blood pressure's up. You know, your blood pressure's low. And one of the other things is that I want to challenge you that when you're going to your doctors, make sure you're telling them the truth. Be honest about what you're going through.
Mhm.
And sometimes we forget, especially as women, we have a lot of things that we're going through, and we're juggling hats, and so we may forget that, oh my god, I was having pains or cramps at this time, or I this was making I didn't write down when something goes wrong. This is what I'm going to challenge you to do. And we used to do with my dad, because when my dad, he didn't have mental health issues. Well, I don't know now, I'm just saying. But he did have health issues, and so we would write down a lot of the things that he was going through. And so when I would take him to the doctor, or when my mom would take him to the doctor, or when we would take him to the doctor, if he was hospitalized, we went back and we could say, okay, this happened. Wait a minute. No, and he would forget, and he was like, well, I don't remember that, or they didn't think it was important. Those little minute
Mhm.
things are important. Like, well, I was cramping on my side and I didn't know it, and next thing you know, you got your appendix rupture and you could die. I mean, not just, we're talking mental health, but I want to tie it all in to
Mhm.
what Shawana has discussed or said about a primary doctor. Go ahead.
Yeah. So primary care is very important, and primary care has somewhat evolved over the last couple years. I will say this because some people think I have to see the doctor. It has to be doctor such and such, and so when primary care is a very robust field now, and so there are extenders that are able to provide treatment and care for you, and those extenders may be physician assistants, they may be nurse practitioners, all of those different credentials. They are able to investigate, diagnose, provide the same type of care that your medical doctor would. And so I'm saying that because it's really important. I know some people are challenged because if the person present to them that they're not a medical doctor, and they say I'm the physician assistant or the nurse practitioner, then somehow or another the person just kind of
Freezes up or
uh,
backs away from it.
yeah, backs away. But
And
please,
yeah,
please,
because the record is
yeah,
there.
yeah, and not only that, but these are skilled and trained individuals that work right up under the doctor's hand, right up under the doctor's care. And so do not back away or shy away from those individuals, because they work, just as hard as the other
Oh, yeah.
provider does. And so additionally, that might minimize a wait time as well if you're waiting to get into your primary care. And if you're persistent that you have to see the doctor, your time may be longer before you can get in, and then of course something significant can happen. But your primary care is one of the places I tell individuals to start if there's a thought or suspicion that there may be some mental illness going on. In our community, sometimes we don't realize that the medications that we might be prescribed or take in reference to our physical health, they tie in and work in conjunction with our mental health as well. And so having everyone that's treating you on the same page in reference to what's going on with you is very paramount when it comes to your treatment. Knowing that, if you have a chronic illness, that you're diabetic or you have hypertension, or high cholesterol, some people might say, well, what does it have to do with my mental health? Oftentimes when your mental health is challenged, those chronic illnesses go unattended because we're not taking medication like we should. We're not, we're not exercising or making the right decisions about eating, which all of that affects our physical health. So, and also there is now more so the way that the primary care can actually also somewhat begin treatment for behavioral health right within the same office. Okay, so that's why, it's kind of changed a little bit. You're not necessarily having to run to 3 or 4 or 5, 8 doctors,
Right.
but start with your primary care. Some of the things, the treatment that you might need can be provided right in the primary care office. And of course, like anything else, if it gets to the point where it's beyond, the scope and practice of what they do, then the appropriate referral is made. And then you may get a, provider that specializes in, the particular treatment that you need. But again, I do say, the primary care office is one that you definitely could start with, in terms of seeking treatment for any potential behavioral health issue.
And that leads me to what you actually do as an independent hold on, make sure I say this the way, independent consultant to healthcare organizations. So tell us about what that looks like and how you assist people that actually need that assistance, to where to go to look for help if they're dealing with mental illnesses, or the types of illnesses and the types of things that you would actually use to help to refer them, and how you can help them.
Sure. So, as an independent healthcare consultant, I work with organizations. I work with both primary care and behavioral health organizations, and I also work with some specialty organizations as well. And these are your practices. These are your doctor offices, your practices. And so, my work and my expertise to these organizations, they come from kind of twofold, from a business side and from a clinical side. So working with these organizations, I particularly help them. If you don't realize, when you work in healthcare, there are a lot of rules and regulations that you have to
Mhm,
follow. And
mhm.
so oftentimes it's not easy to balance the rules and regulations versus what you're actually doing. So to have someone that can, work alongside you to help ensure that balance, so that you are, meeting metrics that, your insurance may require, you're meeting metrics that the federal regulations may require. Having someone to work beside you, to consult with, to ensure that your practice is moving in the fashion that it should be. It is very essential to an organization, because when they open the doors, you not only want to treat the person, with the medical or, treatment, but you also want to be a pretty much viable organization where you can continue to practice. So that's where my expertise come in. I'm not a practitioner of any sort. I'm not licensed to practice medicine at all. Let me make that disclaimer. However, I do work very, much in tandem with those that are. And so being able to bring together a system by where medical treatment is provided, along with a system of effective quality assurance, effective business practices and things of that nature, bringing that together gives someone the optimal experience in terms of what they're getting in healthcare. And so that's where my niche is. I work with many providers across the country. You mentioned earlier that I'm always on the go. That
Yeah.
is correct. I am always on the go. A lot of folks think I'm traveling for pleasure. I wish I was, but most times I am working when I'm from one state to the other. But I work across the country with many providers and helping them, to be aligned, with what's considered with best practices, and, enhancing the medical communities in which they're serving others. So that's, like I said, again, it's very paramount to the health and well-being of patients that they serve. So, knowing where to go when there is a particular issue. Again, I will say you can start with your primary care. However, there are specialty organizations that are out there. You mentioned earlier in my introduction that I was the CEO of Serenity Rehabilitation Services, where we were a integrated behavioral health care organization. We did both primary and behavioral health together. And so you will find practices that specialize in those things, and you can also start there. You don't have to start with your primary care, but at some point you will want to loop them in, on whatever treatment that you may be receiving. But there are many organizations that are out there. Most every county in the country has a county component, behavioral health component to their services that they offer the citizens in their county. Every county does. We're right here in Guilford County, and
Yes.
even though we
336.
share two cities, there is a county component to being able to help with behavioral health. I will say this: you do have your private practices, you do have your local hospitals, and things such as that. And always encourage and help people to be educated and knowing how to make the best decision for themselves. I feel that we are encouraged to empower people to know what or how decisions they need to make. And oftentimes, sometimes in our African American community, we notice that the numbers are somewhat higher than other communities, and we put a lot of charge to the emergency departments. And
Yes.
so, working with providers that work in emergency care, they will help you to understand and educate exactly what emergency care is. And sometimes there is emergency care that's needed
Yeah.
for mental health.
That is
Okay.
true. That is true.
Sometimes we can't wait for, a Tuesday morning
But
appointment.
but a lot
Sometimes
of
it's urgent.
times, if we have that primary care doctor, or we have some place that we can go, and that's why we have the urgent care facilities that you can actually go to, and then and you don't have the financial um, bill that's attached to always having to go to the emergency room and to the hospital. I listen. How can we get in contact with you if we need your services? Is there information that we can give to our viewers that I can put up for you to help them to connect with you so that we can help to make mental health or behavioral what we call it
Behavioral health.
behavioral health so not so bad and not so taboo or something that we don't want to talk
Absolutely.
about.
Yeah, absolutely. My email address is my name, Shawana Torrence at hotmail.com. That is the best way to reach me, Shawana Torrence at hotmail.com. I'll be glad to respond to anyone that's attempting to reach me. But again, that's the best way to reach me, and hopefully, the work that I do here, right here in Guilford County, with other providers and individual practitioners. We're I'm very passionate about that work, and I'm very passionate about helping organizations to help the communities that we're in. Definitely working with the underserved communities has always been something that's at the forefront from me. However, that's not the only capacity in which I work. I work with individuals and companies that are somewhat in a different sector than your underserved. But yeah, my email address, Shawana Torrence at hotmail.com. Yes, I still have Hotmail.
Yeah, and that's, hey, nothing wrong with it. We're going to put this up on the screen for our listening and our audience and our viewing audience tonight. You have been so very thorough and informative. I am so appreciative of you being able to step in, and I can't wait to have the dialogue once again. I'll give her Janet. I can't wait to get Janet Riley Wright back on board and give her time to express her passion about mental illness awareness or uh what we call it
Behavioral health.
behavioral health. I wanted to make sure I use the I didn't well behavioral care, behavioral health, mental illness awareness, and especially in the Black and Brown community, so we're not so afraid of the conversation. Be sure, take care of yourself. Pay attention to things that are happening. Make sure if there's a change in mood, if there's a change in how you react or things that you're doing or your thought pattern, it may be worth it to call your primary care doctor or get a primary care doctor and not just talk to your girlfriends because it could be something that may need more attention, specialized attention. Okay. So listen, I thank you so much for coming and joining me
You're
tonight.
so welcome. You're
It
so
has
welcome.
it has been an absolute pleasure. having you here tonight. You hear it, girl? Hey, you gonna rock with me? Oh, oh yeah. We're gonna get it. I thank you so much, viewing audience, for coming out. Jen- hey,
Oh,
hey,
you are welcome,
thank
Janet.
you.
You are welcome.
Great information. Hey, personality, charm, pizzazz. Living my dreams, you never know what's next. The kind of friend your mama said you need. It's your homegirl, Beat Tina B. It's Beat Tina B. Beat Tina B. It's your homegirl, Beat Tina B. Hey, with Shawana Walker Torrance. And I'll see you next
All
time.
right. Thank you. Have a good night.
You too.